Someone told me this. Okay,
Yeah.
we're on.
Hi, Lori.
Hi, Alison. Nice to see you today.
Nice to see you too, and thank you for making the time in a very busy conference to come and share this time with us. My name is Alison Hoens, and I'm a person living with rheumatoid arthritis. I also have a daughter who has rheumatoid arthritis, and I'm a physiotherapist, and I'm a knowledge broker. And so it's a real pleasure to have a little bit of time with you today to talk about some things that are relevant for parents who have children with arthritis. And I was wondering if you could just give us a little bit of background of how you got into pediatric rheumatology.
Well, I'm actually one thing.
Okay.
I'm a pediatric rheumatologist, and I suppose I could say I'm also a researcher. So when I was doing pediatric training a long time ago, by chance, I was interested in immunology. And by chance, I kept running into patients that I found so intriguing and so interesting. And they were a child with arthritis, or a teenager with lupus, or even a young adult woman with an undefined autoimmune disease. And I was so intrigued and interested both in the science and the understanding what type of disease they had, but I realized that I really liked the idea of taking care of a patient and their family and being involved with them over a period of time and trying to help kids sort of achieve their best outcome. So pediatric, and I was fortunate in that the chair of pediatrics where I was training was one of the most well-known pediatric rheumatologists in the U.S. at the time, Dr. Jane Shaler. And so with an inspiring mentor and a basic interest, perfect.
So I'm hearing you, that's a fascinating story, and I'm thinking that, you know, it's where you are and the people that you're surrounded with, but it was interesting how you said, as a pediatric rheumatologist, it's not just about looking after the child, it's about looking after their families as well. Could you give me a little bit more information on what you mean by looking after their families as well? What does the pediatric rheumatologist, how do you help to support the families in addition to the child?
Well, I think, just from very basics, I always go back to a story that one of our patients' parents tells often about what it was like when their 2-year-old woke up one day with a swollen knee and couldn't walk. And it went on for a few weeks, and eventually they came to see our team, and their daughter was diagnosed with juvenile arthritis. They never knew children got arthritis, but what he talks about is the terror of parents who never heard of something, their child is sick, they don't have any idea about what they need to do, and it's a journey that they have to take to care for their child. An adult get arthritis, you go to the doctor, you have a conversation, they give you the information, and you have to advocate for yourself, but parents have to deliver the treatment for their child, make the choices that are the best choices, and also help their child have a regular life. And we as physicians, nurses, physiotherapists, occupational therapists, we have to provide support for parents to be able to do that. So it is, I really think it's a more complex kind of situation. Everywhere in Canada, in every pediatric hospital, there is a pediatric rheumatology team. So we don't practice, for the most part, in offices on our own. We have a team, and that team includes nurses, physiotherapist, occupational therapist, social worker, sometimes a psychologist, all who are devoted and dedicated and expert in pediatric rheumatic disease. So that's how we do it. Takes a village,
right,
or a group.
That when I think back to and building on what you just said, as a parent, the journey in parenting alone is challenging.
Oh, yeah.
Whether your child has a condition or a condition like arthritis in specific, and sometimes it's really hard to figure out how big a problem something is.
Oh, yeah.
And are we overreacting, or are we being negligent by not responding to something? What, as a parent, what do you tell? If you had the opportunity, like now, to share with parents, what are the signs that they should really pay attention to in their children that would help that they should be seeking further care?
Well, I think it's a great question, Alison, and the reason why is that even in our country with such terrific health care and universal health care, so for example, here in BC, every year we see, and now it's a handful, but we see children and teenagers who come to see us who have had arthritis for a year and have seen healthcare providers, and it wasn't recognized that this was arthritis. So for parents, I think that's tricky. If you go to the doctor and the doctor says it's a sprain, what are you going to do? But I think for parents, the red flags are the things that would really alert you to say, well, maybe this is more than a sports injury. Would be certainly if there's one swollen joint or multiple swollen joints, and that lasts for longer than you would expect after an injury, so more than a week or so. A child who wakes up in the morning and is very stiff in one or several areas and has trouble getting going in the morning. Pain in the joints that lasts for longer than a day or two after what you might think would be a minor injury. And some children with arthritis are quite sick and have unexplained fevers or skin rashes. They might have other symptoms that make you think, oh, that's some infection. But if it goes on for longer, it might not be. Okay,
so when you say that there's swelling, that the joints look swollen, how does a parent who hasn't had the opportunity to learn what a swollen joint are there things that they can feel or they can see that would help them?
I think it's very tricky in young kids who are pudgy. They're sort of well-rounded, sometimes really hard to pick up, particularly in some areas, like at the ankle is very hard to sort of look at. But it's really interesting. Parents are the best observers of their own children, and particularly young children. And even young or inexperienced parents can usually tell, like, one knee is big compared to the other side. One finger is enlarged. So I think a lot of times in younger kids, that's actually, parents are able to pick that up. I think teenagers, it's harder because obviously we're not giving our teenagers a bath anymore. So we're not looking at them, and sometimes they're not clear, or some kids present with arthritis and they have very bad back stiffness or stiffness around where ligaments and tendons attach to bones. So it's tricky.
So what I'm hearing is trust your gut as a parent. If you think that there's something wrong and it's been persisting for a while, and if it looks different from another place and their behavior has changed in some way, they're moving more slowly in the morning and it takes them a while to do it, not just because you think they're being lazy and sleeping in, but their movement looks different, then it's worth pursuing.
Yeah.
Another thing as a parent, then you note those changes. How do you go about finding the appropriate? I mean, you've done extensive training. How do we access people like yourself?
So we get referrals in BC, and I think it's true across Canada. Pediatric rheumatologists generally get referrals, actually at least 50% of the time, from family doctors. So family doctors can refer directly to a pediatric rheumatologist, or sometimes the best route is the family doctor sends the child to a pediatrician, because arthritis is a symptom, and there is a list of things that has to be considered. And so sometimes a pediatrician is the right first step to get, and then they might recognize that this is looking more like a chronic condition than something that's going to get better. That's, and as I said, the other, thing to note is that at every pediatric hospital, there is a pediatric rheumatology team. And you can usually find them online because we are listed there. So you can...
So you look up your hospital, you go to the hospital webpage and specifically look for pediatric rheumatologist.
Yeah.
Okay, thank you. So let's suppose then, we've gone to how to first identify it, how to seek care, then after diagnosis, and thank goodness for some of the great drugs that are now available that weren't available many years ago, and a diagnosis at that age would result in significant deformities for children. So you take the drugs are commenced, the treatment with physio and occupational therapy is commenced and things like that. And things look like they're improving, but how do you know, without being like hyper vigilant and looking for, being concerned and watching for everything, when you need to go back, when you need to check up again?
So, I think all kids who are being treated for juvenile arthritis should have regular scheduled follow-up with their pediatric rheumatology team. So, for example, in our program, we would see people every 3 or 4 months if they're on, certainly early in disease, if they're on active therapy, maybe less frequently if they're doing really well, maybe less frequently, but we don't tend to give people medication and see that they're doing well and say, oh, follow up with your family doctor, because I think that that's not really effective for kids with arthritis. Family doctors don't have the training or the expertise to manage juvenile arthritis. And in addition, there are other issues that come up that really a family doctor doesn't have the capacity to deal with. So even if your child with arthritis, school-age child, is on medication and doing pretty well, there might be some issues around school. Maybe, a kid in grade 1, when they're supposed to be able to sit on the carpet with all their friends, in school.
Yeah.
Maybe,
I remember those days.
We have kids who just can't sit on the carpet, really. Their knee is too stiff, and they sit on the carpet. It's really uncomfortable or painful. And so we need our physiotherapist and occupational therapist to write letters to the school and say, please allow this child to sit in a chair, or, please allow this child to participate in physical education to the best of their abilities. So there are many management issues that come up that are beyond just getting the prescription and going home and getting a blood test.
So some of that might even include things like their pens, other equipment.
Yeah. And that's not there's, I think that there's a really valuable role of pediatric rheumatologists in transition as kids are moving into young adulthood, to teach kids, teenagers, how to self-manage their disease, to get them into the right situation as they move out of pediatrics.
Thank you. I'm noticing our time, and I'm wondering if I might just ask one more question. The theme of this conference is around precision medicine. What does that look like in the pediatric world?
Well, I think that we are moving towards that. Right now, I think we are at a very early stage of being able to really identify which medications might work best in which type of child. We have some very gross measurements. You have more than 5 joints involved, or some other clinical findings. But what's really going to revolutionize things is our pediatric rheumatology community has just been awarded a huge amount of research funding. And it's really,
Congratulations.
thank you, it's not to me, but it's to all of our colleagues. That's going to revolutionize our ability to identify what kind of medications are the correct medications for each child. And not only that, when is it safe to stop them? When can we stop them and a child won't flare up? And this project, it's so massive, I can't even explain it, but it involves every kind of genomics, everything you can think of, all together in a computerized way to be able to do what you're talking about. So we're on the first step.
Maybe we can ask you those questions at the next conference.
A couple of years, yeah.
Okay. Are there any questions from the audience?
We have a couple of questions from the audience. Can you see the cost of juvenile arthritis medications coming down soon?
Well, when I am queen of the world, or maybe, I don't know, prime minister, yes, I would do that. I think that's a complex issue. They may, because as medications are on the market longer, and we have new what are called biosimilars, so those medications are somewhat cheaper. So I think that is happening. It's a little more complicated in children, where drug testing isn't as common, and that's a bit of a problem. But I think that's a significant issue.
Is it true that there is a small community of pediatric rheumatologists in Canada? And if so, how can we encourage students to pursue this very important career path?
In fact, we are a small community, but mighty. So there's probably about 40 of us now. But as I said, and interestingly, there's a lot of interest among medical students and pediatric residents in pediatric rheumatology. Like, we have no trouble filling our training programs. There's really probably not a role, let's say, for a pediatric rheumatologist to live in Thunder Bay, or to live in Prince George, or to live in some small communities. There just isn't enough patients to be caring for them.
That's a good thing, right?
It is. So we use novel or different models of care for taking care of kids in small communities. We all across the country, many of us travel to small communities and do outreach clinics. We here in BC and in Ontario, I know the pediatric rheumatologists, we're starting to do a bit of telemedicine to try and sort of see kids more easily. So I think there are lots of ways to take care of kids that maybe don't need to have a pediatric rheumatologist in their community.
That's good news for parents, because then they don't have to pay the costs and trying to find accommodation and fly down.
Yep.
Yeah.
I was just in Prince George last week. The week after, they had 50 centimeters of snow. But we saw 42 children from all across the north who came to see us in Prince George. And we go up there. We're going to go up there 4 times a year now. So incredibly valuable for those kids and families.
Thank you for doing that.
And finally, what age do children change over to an adult rheumatologist, and are they followed in research? And how is this transition from a pediatric rheumatologist to an adult rheumatologist then?
That's my favorite question, and I could talk for another hour on that. But in brief, most programs, kids move around the age of 18 or when they graduate from high school to some sort of adult service. In some provinces, like here in BC, we have a young adult clinic where we see kids between the ages of 18 and 22 and then move them on to an adult rheumatologist. There are some what are called transition programs like that in a few other provinces, or transition planning type of activities. So there's a lot of work that the pediatric rheumatology team tries to do with kids and their parents to get them ready to be able to go to the adult rheumatology world, because it's very different. It's very different. And people need a bit of training and to become sort of a self-advocate, to know how to manage their own. We have lots of kids who are 18, 19 years old, and their mom has always given them the medication and filled their prescriptions. And you have to learn how to do that yourself.
It's a different world.
Yeah. So It is an important area for us and for our adult colleagues too.
So I just want to thank you again, Lori, for this chat today. I mean, you work with small people on big issues in a very meaningful way. And so on behalf of all of us who are parents with children who have arthritis, thank you to you and your colleagues and all those who work with you.
Well, thank you for inviting me.